trained to cooperate. Are we ready?
Yes, sir.
Dusty, would you like to lead us to the Pledge of Allegiance?
Sure. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning, everyone.
Morning.
Welcome to the Shawnee County Board of County Commissioners. It's October 22nd, 2020. On my left is Commissioner Aaron Mays, who represents District 3, and on my right is Commissioner Kevin Cook, who represents District 2. I'm Bill Rippon, and I represent District 1. We're having some trouble streaming today, but we will record this meeting, and so we will have it online later on. What's first?
Were we adding something to the agenda?
What's this?
We need to add the
Were we
item
adding
to the
something
agenda.
to the agenda?
Sorry.
We need to add the presentation
Oh,
to the agenda.
I thought we could just, okay, we actually have two presentations that we need to add to the agenda. Do we need a motion for that?
Yes.
Okay, I'll make the motion to add, one would be from Election Commissioner Howell. He wants to give just a 3, 4, 5 minute presentation on how the elections are going. And then we have a second one from Dusty Nichols about, it's COVID related. So.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries. And we'll add that to the beginning of the agenda.
Okay.
Under presentations, can we put it there?
Yes.
Okay.
Under proclamations, number 1, proclamations, presentations, presentation by the election office.
Okay.
Good morning, Commissioners. Andrew Howell, Shawnee County Election Office. Just wanted to give you, I'm actually on my way over to board training for about 300 and some election workers here at 9:30, so I'm going to be very brief. Just wanted to give you an update on how it's going and give you some numbers, and then we hope to be back with you again here over the next week or so talking about some of these numbers additionally. First of all, I wanted to kind of let everybody know we ended up with 116,415 registered voters, which as far as I know is a record. Going back how far, I don't know. I've only been doing this for about 8 years. It certainly exceeds what we've seen in the past. A lot of new registrations, and like I said, I think the highest number I've seen before was 113,000. So we're up well over 3,000 voters in total on our registration roll. So that's a good sign. Wanted to let you know about that. Additionally, I think our traffic in the office has been very big and very consistent. We are managing to keep wait times, I think, to a reasonable number, all things considered. Most people tell me they're making it through without too much trouble in 15 minutes. I think we had a couple of points on the first day when we were hitting 25, 26-minute waits, but we're getting people processed, I think, fairly efficiently. And so I think we're pretty happy with the numbers that we're seeing. And then, and if you can just happen to hit it just right, you can make it through in 5 minutes. But it just kind of depends on how many of your neighbors walked in right in front of you on and which day it is. So I think just wanted to let you know we feel pretty good about how that's going as far as voting in the office. Just to give you some numbers, on Monday we had 1,938 voters through there. Tuesday we had 1,837, and Wednesday 1,851. So big numbers, consistent numbers, and actually those numbers are the second, third, and fourth highest all-time numbers of just voters coming through the office in a single day. And the only number that actually beats that was the 2016 election. I think we had 2,541 voters through there in that last Monday before the election. So I will say, if you want to vote based on the trends that we're seeing, I would try to do it before that Monday before the election, because based on the trends that we know and what we're seeing, I expect there will be some significant wait times at that very last little bit on that Monday. If you're in line at noon, you know, the Monday before election, if you're in line before noon, we will get you processed. But if you and all of your neighbors show up at the same exact time, it's going to take a little bit to do. So I guess I recommend people if you're going to vote early, try to get by and try to do that before the Monday before the election, November the 2nd. Just some other numbers of interest I think that people will find interesting. Ballots that we've received through the mail were already at 5225, so over 5,000. In the office, we've had people drop off 1,568 ballots. At our, I'm going to call it Mobile South across the street, we've already had 3,880 ballots dropped. And then in our trailer that we're moving across the city and county, we've had 325 ballots delivered that way as well. So total mail ballots, 10,998 received, which is approaching 50% of everything that we sent out that first day. So a significant number of those ballots we've received back already. I think that's a good sign. And we will try to release some additional information with some of these stats later today with some additional percentages and other information that I think people may find interesting. The other thing I might mention is, due to the high traffic count that we're seeing in the office, we're doing deep cleaning, we're doing some additional sanitizing that we really hadn't planned on originally, but we think it's smart, we think it's a good idea. So just to let the public know that we are taking that seriously, and we are doing some additional precautions, asking everyone to wear a mask, and we think that that's a good idea as well. Commissioners, if you have any questions, I'd be happy to try to respond to any questions you have. But as I said, I think our mail ballot program is working well. It's well received. People seem to appreciate the opportunity to drop their ballots. And additionally, I think our numbers in the office and wait times are in good shape. So we're looking forward to Election Day. Be happy to answer any questions.
Mr. Chairman.
Mr. Cook?
I think those are some numbers that we need to repeat. The train was going by, so I'm not sure everybody heard, but 116,415 voters for this election. Highest number that you've seen by 3,000. That's some really great numbers. And then you said during your presentation that the mail-in ballots, we are approaching 50% have already been returned. And I think when you and I were talking earlier, you said that approximately 10% of the registered voters have already voted.
Correct, yeah.
And that's in the first week. Not even the first week.
Yeah, it's not even the first week. We started voting in the office on Monday, and then, of course, we mailed ballots out last Wednesday, but those didn't get to the voters till Saturday. So effectively, they've had up to 4 days. So I think people are energized. I said we're seeing that on both the ballot front of the mail side as well as the traffic in the office. So I think those are good numbers, and we're...
Additionally, I mean, what would we typically see on a election for a presidential year? What percent?
I was just looking through some of our numbers, typically we have a really big day that first day. We had 2,000 voters in 2016 that walked through the office, but then the numbers kind of starts dipping down a little quicker, but we're seeing really high numbers consistently. I don't know that I've got the exact percentage, but I know that overall, we're fairly similar on people coming through the office to what we saw in 2016, but it seems a lot more consistent, and we're seeing a lot higher mail ballot numbers by far. I believe the number for 2016 in total was like just around 8,000. So we've already received more ballots in the mail this election than we sent out and received back in the entirety of 2016.
Well, I mean, I recognize that back in 2016 we had 8,000 mail ballots, and you almost tripled that number this year in mail ballots.
Yep, no, that's correct.
And Andrew, the people that are reporting to me say that the wait's been about 5 minutes. It's been very smooth, no problems, and that your staff has been very courteous. And I appreciate that. Nothing but good news and smooth. And so, kudos to you and your staff and the hard work that's being put in.
And I do think it's important to say we have, to a person, the people working in the election office are working very, very hard, very long hours. There's a lot of processing time. Not only are they helping people vote throughout the day, but then there's mail to deal with at night. There's applications that have to be scanned in. There's applications that have to be sent out, and there's a lot of phone calls. So it's a major operation, and I have nothing but praise for the people that work there. They do excellent work, and they're very focused and good at it.
Yes, Commissioner Cook.
I've got a couple questions. With this high number of advanced voters, will that alter the election day results coming in? Will they be faster? Will they be more secure? if we know that we've already got those in-house?
Well, I don't think it will speed up the process a lot because we still have to receive back every stick from every polling place. So we still have just the mechanics of getting however many there are back to the office. It may speed it up slightly, I don't know, but I know the Johnson County Election Commissioner has stated publicly that they expect a 90% turnout. We're used to seeing 72 to 75%. So what I really don't know is we may see the same exact number of people at the polling place that we've always seen. It's just really hard to predict for this year. We know that mail is up and early seems significant. I just don't know if that's also a trend that will then continue on election day as well. If you have 90% of voters show up, it may end up being the same traffic pattern at the polling place that we've seen. It's just additional mail and additional early. It's just really hard to predict that at this point.
Okay. Now, there's only a handful of counties that have election commissioners. I assume you guys talk on a semi-regular basis. Are they seeing the same numbers as we are? Or, I mean, I like to think that we do it a little bit better than some of those other counties.
I think it's fair to say everybody is seeing fairly off-the-chart kinds of numbers for mail as well as walk-in traffic. And I actually have not had time to visit the last couple of days, but I know the mail numbers are just huge elsewhere. I actually have not had a chance to visit with them about walk-in traffic so far.
Okay. Well, I can speak from a firsthand experience. I went in there on Tuesday. And I can say it was a little intimidating pulling into the parking lot because people were parking across the street and walking. It looked like it was going to be completely overwhelmed, and I was prepared to wait for quite a while. And even when I opened the door, the line was pretty long, but it went so quickly. I was in and out in under 10 minutes. I felt totally good about the experience. I was shocked at how fast it went. So I appreciate all the hard work that your staff is doing over there.
Thank you. Appreciate it.
I too have heard nothing but good reports from those who participated in early voting, so I appreciate that. I know that doesn't happen by accident, so thank you.
Appreciate it. Thank you. And like I said, I'll try to be back a little more often for commissioners just to give you an update on how it's going because there's a lot happening and we'll try to keep you better informed as we go forward on that. So appreciate the opportunity. And
I know you guys have put in a lot of late hours. And,
a few.
we appreciate it.
Thanks.
Thank you.
Thank you.
Thank you, Andrew.
Next presentation.
Item 2 under proclamations presentations, presentation by Dusty Nichols on whatever.
Good morning, Commissioners. Dusty Nichols, COVID-19 Incident Commander. On Monday, Mr. Doug Rosencutter from Doug Service Center during administrative communications presented some concerns he had regarding communications from the health department and customer service from the health department. That discussion led to your request for me to look into and do a review of those two specific things. This is not a review of Mr. Rosencutter, his case or anything else, but it's specific to health department communications and consistency. So the introduction here is Mr. Rosencutter made those statements, drove me to do this report. And just as the bottom bullet states, the report was developed by reviewing emails, personal accounts of phone conversations, personal accounts of on-site visits, interviews, social media, television media reports, YouTube video of the BOCC meeting on Monday, and other documents and current policies and guidance. All of those are reviewed in this review. The review of the actions of the Shawnee County Health Department showed at least 2 attempts initially to gather factual information, and at least 6 direct engagements of one-on-one customer service with Mr. Rosencutter to support him and his business. The review, his own accounts taken from the statements he made during the YouTube video were reviewed numerous times by myself, and he basically said, he verbatim said he was confused and the information was confusing and possible misinformation, and it's not uncommon. And this is exactly the reason why the health department and the people who talk to patients in this situation actually use scripts and guides. And I have copies of those if you'd like to see those. So it's not uncommon, the confusion happens, especially even in the discussion with the commissioners that day.
between the quarantine times and those kinds of things are confusing. So it's further understandable, the confusion, because he reported that his personal physician's nurse had called him and told him something different, and then he even stated that he didn't get all the information at one point. So, and then looking at that information, the information disseminated by the health department is again done by scripts and visual aids. So the consistency in messaging from the health department has never changed. It's always been the same thing based on those scripts. And we use those again for consistency. I can't understand his confusion if his personal physician's nurse told him something different or there was some information dropped. I can't speak on that. I can just state I can understand the confusion if that did happen. But it also leads to an improvement point for our side. Education needs to happen. Further education, as Commissioner Mays indicated, and I think all three of you had stated in previous meetings that it's nearly impossible to educate everybody, but we do try our best. So we can explore more educational campaigns going forward. And I already spoke on that first bullet. Again, if any business out there has an issue with COVID, they can call the Shawnee County Health Department to get assistance, but there's also information out there in the CDC, and it's very specific to different industry, whether it's restaurant, maintenance, any other kind of industry, if they have an issue. But again, those the guidance that they use can be found at KDHE's website, KDHE right there. I put the link there, but it's very easy to, if you go to go to Google and type in KDHE quarantine timeframes, it'll come up as one of the top searches. It's a PDF, and that's the same one that the health department uses. So the finding on that initial consistency of information, again, I could see the confusion from what he believed his personal physician had stated and what the county guidance was, but the consistent messaging from the health department is just that. It's very consistent based on scripts, repetition of being commonly, all these common phone calls and the common situations that happen, so that I didn't find any inconsistencies in any communication. So a review of all the communication with Shawnee County Health Department messaging indicates consistent and use of scripts provides and visual aids. It was found that the guidance was used throughout the communication with Mr. Rosencutter. Concerning the customer service, the initial report came to Shawnee County Health Department through KDHE anonymous report of Mr. Rosencutter being COVID positive. A lot of times these reports come to us, we send an investigator out or call and validate whatever the case calls for. So verification on all these rumors are needed. Most of the time, these rumors are just that, they're rumors or they can't be proven. They're complaints or misunderstandings. This particular one was validated. So here's basically the timeline and the discussions that happened. So you can see there's been at least 6 that happened after we made initial contact. A lot of the same information was repeated during that time frame. So. And regarding the opening plan, there was an entire day of back and forth emails between Mr. Rosencutter and Shawnee County Health Department Division Manager, and those emails were back and forth trying to get those plans so he could reopen. So the outcome of this, the information provided Mr. Rosencutter by the Shawnee County Health Department was consistent throughout the entire event. Scripts, visual aids, and guides are used by Shawnee County Health Department personnel assigned to talk to patients, and department staff applied expertise, guidance, and one-on-one customer service to Mr. Rosencutter throughout the event. Some of the improvements we can make based on this, reminder, current restrictions, whatever they are, the COVID protection measures that the county resolutions and the health orders state, they probably need reissued to kind of put on top of that. We have seen a lot of social media reports thinking that the resolutions and stuff have expired. They have not. So we will probably reissue those and reiterate what those protection measures are currently. Education of isolation, quarantine, and timelines and COVID protection measures. Again, those timeframes can be confusing, and we will do an education campaign to put that out. And again, review and work to provide consistent messaging within the healthcare industry and private, that's private and public. So we do want to probably look at what private industry is advising patients, and if it's different from KDHE's guidelines or Shawnee County Health Department guidelines, make sure we can get those matched up so we don't have miscommunication. Redevelop and reissue our media releases regarding where people can find information if they become COVID positive. Again, that's the CDC and KDHE websites. There's a lot of information out there that can help business owners specifically and patients that may come down with COVID or household contacts. Possible media releases and checklists that provide further guidance. That's not just those, but on top of those, we do have checklists that Shawnee County Health Department, Craig Barnes specifically, put together, and when businesses do call, it goes through that checklist to help them get their business back up and running, and those were used as well. We need to continue to gather data and develop frequently asked question sheets, because that's where we do find information that people want to know. A lot of times we get in here, especially when we see it day to day, I think there's an assumption that that everybody knows, and I think that's a mistake that we can fix easily by just creating these FAQs, because again, it's almost impossible to educate every single person. And we need to continue to work with investigators and document the issues, make sure these things are validated. If they are rumors or complaints, find the truth in those and report them back. Do you have any questions?
I do have a question. These scripts and guidelines, are they given a copy of that when we go talk to these individuals?
The scripts and guidelines is who given a copy? The people that they're talking to?
Yes.
They're not given that. These are, excuse me, I just selected the wrong one.
I think the confusion's coming from, the guy went to his doctor, and the doctor told him one thing, and then
Right.
our script or the contact people are telling him something else.
Sure.
And
Most of these are done by phone call. So the script is from the
I see.
biodefense people. I just put a copy of it up here. That is used, and if
What-
the guidance they give, and then the other guidance that they're using is the isolation and quarantine.
once they give them that guidance over the phone, do they follow up with something that's written, telling them what days and their?
Yes,
Okay.
in fact, on this particular case, I've found at least twice, I think it's at least 3 times that Mr. Rosencutter was advised the dates that are on this sheet right here.
Because I think the real confusion was, the doctor said 72 hours, it's just 3 days, and
And
that's.
part of that is, if you look at this case, is the onset at the very top, it's the minimum of 10 days, and then that's 72 hours. I think he even said when he talked to you guys on Monday that that was a piece of information that he didn't get, or something along those lines. I don't have the exact
Whichever is
quote,
later.
but I think he stated something along those lines that he didn't get that piece of information. So,
But even still then, he was still at his work after being advised not to be there. And there was confirmation that he was there without a mask after being advised that he shouldn't be there. 6 different contacts, which is inconsistent with what he presented on Monday. So, I mean, if he was handed this, I can understand there may have been confusion between what your doctor tells you and what you're being told by the health department, but how many times and how many pieces of paper are we required to give somebody? I mean, 6 times, 6 contacts, one-on-one contact. What more do you expect from the health department? They're working very hard, and our staff is very professional.
I was just talking about the initial contact that they're given. It was just a question. I'm not defending anybody, I'm just asking the question.
if I could, there's a couple things I just want to add to the end of this. After doing this entire review, as you guys know, I'm an emergency manager. That's my profession. I'm put in the incident command role to monitor and make sure this incident is connected, consistent, all the coordination is done, and I manage the incident. It's not very often I get a chance to look at the tactical level of what the health department does, and I have to say this allowed me that look. I'm extremely impressed with the professionalism, not only from the health department leadership, but the people who are actually making these phone calls. The level of care they put into their job, and what they want to do, the intention of even having a health department job, and the passion they show. I just want to say I'm extremely impressed. They do a fantastic job at all levels. And I also want to add that there was mention that by Mr. Rosencutter that people are scared to go to his business because of the COVID. I think that would be a mistake to lose a local business because of being scared. I don't think there's anything to be scared at. Again, I've said repeatedly, wear your masks, keep social distancing, respect the threat, use sanitizer on your hands. Even if you have gloves, your gloves become just like skin, just sanitize as you go. I think Doug's Service Center is a viable option if you need those kind of services, and I would consider them an option if I did. So please use local businesses.
Thank you.
That's all I have, sir.
Thank you.
I have one question here. More of a statement, I think, is one of the things that I was most concerned about the other day was just the necessity of the deep cleaning, the professional deep cleaning. After being closed for a few days, it would seem that perhaps that was something that, wasn't as important, knowing that there was nobody in the building for multiple days. So
I know the conversation you talked about. I wasn't asked to review that part. I can go back and look at that. I know we have health department personnel here that can discuss that piece if you like.
I don't know that we need to discuss it, but what I'm saying, I guess, is that in the future, if situations like this arise, and I hope that they don't, but if another situation like this arises, I think that we should take that into consideration when we're, making requirements of the business.
I believe that's a solid comment, sir. I think it is under consideration, but we can make an extra effort, I'm sure. I know the people that need to hear that are sitting here, so I think it's heard. And I will also add that there are many businesses that do deep cleaning, and you might shop around. That's the only thing I'd add.
Can the business themselves do the deep cleaning, or do they have to have professional?
Again, I can answer that, but I don't feel qualified to answer that. If somebody else wants to step up and say something, but there are options, I believe.
Okay.
It's going to depend on the situation, the size and time and different things, so.
Yeah, well, I think in this situation, the owner of the business had COVID, so probably wouldn't have been the ideal candidate for the deep cleaning.
Well,
but
he could have had a friend do it, or a relative.
I think the fact that he was COVID positive probably had a difference on the level of cleaning that needed to occur. But I'm just kind of speaking without the details of that. So, any more questions?
thank you.
Thank you very much.
Thank you.
Next item.
Item 3, consent agenda.
I would move that we approve the consent agenda.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business A, County Clerk, number 1, consider all voucher payments.
Commissioners, we have 2 vouchers this morning. The first is our voucher report, of which there was $1,407,723.51. The highlight out of that voucher report, the highest expenditures, was CAPER's contribution to the retirement accounts of employees, $341,641.40, followed by solid waste, $333,256.60. Again, solid waste is an enterprise fund. It's not taxpayers funded. The expenditure primarily was with Elliott Equipment Company for $103,271 for the purchase of a new truck, minus the trade-in and freight. The next was followed by the bridge, which was $276,668.35, which was to Bettis Asphalt and Construction, which is the work that's going on Southeast 29th Street from the 470 KTA to Croco Road, followed by the Department of Corrections, $89,383.79, of which that was primarily Airmark Correctional Service, which is meal service for September, and finally health insurance premiums for the employees, $78,705.47. I don't have any questions regarding the vouchers. Would move for their approval. The second voucher report is for $46,813.66. That is a COVID CARES Relief Act fund, of which went to community-based programs, municipalities and cities, and schools and private services. And I would move for their approval as well.
I'll second the motion. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
There are no correction orders, and we will not have correction orders for the near future because we're in the process of, I'm setting levies right now. After I get all the levies set and verified, I will be turning the information over to the treasurer, and he will be issuing tax statements. So until after that all happens, you won't be hearing correction orders for a while.
Okay, thank you. Next item.
Item B, Health Department, number 1. Consider authorization and execution of Contract C-429-2020, renewal of agreement, Contract C-344-2018 and C-345-2018 with custom data processing for electronic health record software, October 25th, 2020 through October 24, 2021 at a cost of $45,840 to be paid by program revenue and tax allocation.
Good morning, Commissioners. Edith Gaines, the Finance Officer with the Shawnee County Health Department. This morning, I am here to talk to you about the CDP contract. We entered into this agreement in October of 2018, and at that time, there were 4 other counties in a collaboration to purchase the same system. So in November, we had a kickoff meeting, and the whole first year was mainly getting the system configured and training, creating interfaces with other programs. And so we were originally scheduled to go live January of 2019, but that was deferred until October 1st, 2019. So we have actively been using the system for 1 year now. And this system is used by our Clinical Services Division, our Family Health Division, and our Finance and Administrative Division, which includes billing and medical records. The license fee of $45,840, that covers the actual practice management software, the billing clearinghouse, and our user licenses. So as of this time, we are still in collaboration with 3 of the original 4 counties. That's Wyandotte, Riley, and Douglas counties. And the APIs that we have integrated with are WebIZ, the Kansas Health Information Network, the Waystar Billing Clearinghouse, and DAISY, which is a program-required reporting tool. So I'd be happy to answer any questions you have this morning.
Questions?
Well, I just a real quick one. You mentioned that a lot of the upfront time was spent just making sure systems can talk to one another and things.
Yes, sir.
Are we in a position now where that's all done and things are working well?
It's for the most part, it's done. We are still working out a few issues with the DAISY interface, but all of the other interfaces are working.
Okay. All right. I'll move to approve. Thanks
Second.
again.
Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B2, consider authorization and execution of Contract C-430-2020, renewal of the Tuberculosis Control Program agreement with the Kansas Department of Health and Environment to provide the Health Department with $3,000 to help offset the use of local funds in the prevention and control of TB for the contract period of July 1, 2020 through June 30, 2021.
Good morning, Commissioners. Linda Oakes from the Health Department. This is an annual contract that we usually make this agreement with the Kansas Department of Health and Environment to provide services to people with active tuberculosis and also people with tuberculosis infection. And so it helps defray some of the cost of the case management, direct observation therapy, evaluation with a local physician, contact investigations, which we do for TB also, as well as COVID-19. And it is based on our active cases over a 5-year period. We don't have a lot of active TB, and we want to keep it that way. So that is why we enter into this agreement. And I'd be happy to answer any questions.
How many TB cases do we get in a year's time?
Between 1 and 5 right now is how it's been running.
Okay, not much. Any other questions?
I'll move for approval.
Second. Motion's been made by Commissioner Cook, second by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item B3, consider approval of resolution number 2020-55, authorizing the Shawnee County Health Department Director to execute contracts for the rental of hotel rooms for COVID-19, tuberculosis quarantine, and isolation.
Good morning, Commissioners. Linda Oaks from the Health Department again. We are asking you to authorize me as the director to enter into these agreements so that we can house people who need to be housed, we can do it safely, and we can do it confidentially. So this would protect the businesses as well as the people that we are serving. And I would, of course, be working with County Counselor's Office very closely on these. Ashley Biegert has been helping me get this ready to go. And so sometimes people do need to be housed separately from their household in order to keep everyone safe. So this would enable us to do that. And I'd be happy to answer any questions.
Any questions?
I would just ask that in addition to working with the counselor's office, to make sure you're also working with audit finance.
Of course.
As this money is going to have to come from somewhere.
And I appreciate that. We, of course, will do that. And right now, this money would come from the TB grant or the COVID-19 funds. So.
Okay. Any other questions?
I'll move to approve.
Second.
Motion's been made by Commissioner May, second by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Linda.
Thank you, Commissioner.
Next item.
Item C, solid waste. Number 1, consider approval of request to award the bid to Waste Equip for various sizes of commercial containers required to maintain an adequate inventory at a cost of $22,509 with the funding from the collections operational budget.
Good morning, Commissioners. Bill Sutton, Shawnee County Solid Waste. Earlier in September, we asked for a request we got for quotations for 30 commercial containers of 3 different sizes. 4 vendors submitted bids. It was determined that Waste Equip was the lowest and most responsive bid. You see the sizes of the containers there, 10 6-yard containers, 10 3-yard, and then 10 8-yard containers. We're asking approval of this bid award and purchase. Total expenditure would be $22,509. This will be coming out of the solid waste operational fund, which is 100% user fee funded and not taxpayer supported. Standing by for your questions, Joe.
Any questions? I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, second by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you,
Thank you, Bill.
Commissioners.
Next item.
Item D, Court Administration. Consider approval of request to waive the purchasing policy to pay Binswanger Glass for 6 invoices totaling $10,950.98 for outfitting courtroom B with plexiglass barriers to mitigate the spread of COVID-19 with payment from Spark funds.
Good morning, Commissioners. Lee Welch, Court Administrator, 3rd Judicial District. As Betty pointed out, as Cindy pointed out, we're requesting to waive the purchasing policy to provide plexiglass barriers within one of our courtrooms. This was the first courtroom we've outfitted using Spark funds. Our intent was to originally outfit 4 of our large jury courtrooms with plexiglass. However, we're finding that might be a little bit difficult. This bid came in just over $10,000, which is why we're requesting the waiver of the purchasing policy. This amount, as well as the other courtrooms, were submitted and approved for Spark funding previously.
Questions?
I'll move to approve.
I'll second. Motion's been made by Commissioner May, second by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you, Commissioner.
Thank you. Next item.
Item E, Parks and Recreation. Number 1, consider approval or request to solicit bids for a restroom renovation at the Crossover Tennis Facility at Felker Park with a project estimate of $236,000 or $236,020.
Good morning, Commissioners. John Boyd, Parks and Recreation. We are requesting approval to go out for bids for the restroom remodel at Crossover Tennis Facility. Your approval would allow us to go ahead and get the process started, and once we find out about our potential award from the Land and Water Conservation funds, that would allow us to speed the process up. If you have any specific questions, our project manager, Brian Toby, is here. We also have several representatives from Topeka Tennis Association as well. You happen to try and answer any questions.
Okay. Yes, Commissioner Cook?
Can you tell us just a little bit about what you envision from the project? When we're going to go out for bid, are we looking at building a whole new facility for the restrooms? Are we adding onto the, what people would see at Crossover, which is the clubhouse area for restrooms? Or are we just remodeling what is already there? Or all the above?
To my knowledge, I don't believe we're adjusting any of the outside walls. We are upgrading the restrooms, bringing them up to ADA standards, and cleaning them up.
Because I know that one of the issues that's come up is when we have large tournaments, and we've had large tournaments frequently at Crossover, is that when we bring in portable restrooms or the porta potties, a lot of the participants are dissatisfied with that and would like to see a more permanent restroom facility there. And that's maybe what's keeping us from getting some of the bigger tournaments and more tournaments, which do contribute to economic activity in Shawnee County through hotels and through restaurants and other expenditures.
The way the design is laid out, basically it's a demo of the interior, existing bathrooms, redesigning the layout, and adding additional stalls and more facilities.
Okay. So I know that at one point we had actually talked about, maybe Commissioner Mays had brought this up, about if pickleball could be relocated or having some pickleball courts added to Crossover that might be able to add on to that facility as well. And I want to make sure that when we're doing this, we're looking not just at today, but down the road too. So,
Is this a project that Sparks money could have, or CARE Act money could have been used, or do we know?
We was just having that discussion. If we was able to turn this around fast enough, we could potentially use some CARES Act money, yes.
What is the timeline on this project?
I believe it's the end of the year, correct, for the CARES money. As far as the timeline for us, we're still waiting on any funding from the Land Water Conservation Act.
Oh, okay, so we may be waiting for a
Betty
while.
Griner, Director of Administrative Services. To use any Spark money or coronavirus relief fund money, the project would have to be completed and in use by December 30. So that would include the bid process, the contract process, and all of the construction.
That probably wasn't going to happen. Thank you. Go ahead.
Bob Keeshan, Topeka Tennis Association. We're affiliated with the United States Tennis Association, which has given $25,000 to Lake Shawnee and $50,000 prior for this project. I want to thank the county, Brian and Tim, for working with us on these plans. Commissioner Cook, this project does not change the footprint, so to speak, other than it relocates the entrance somewhat and makes it more efficient. We're glad to work with Parks and Rec. I was talking with Tim about how now that we have a memorandum of understanding, we can go forward on some other projects. If in the future there was a desire to work with us on a combined facility at Crossover, I think the Topeka Tennis Association would be glad to do it. But my point is, our last tournament is October 31st. We want to get this project bid and ready to go so that it can be done in the winter. It's inside work. I think you'll have some bids, hopefully below the estimate, but it needs to get done. We've been working on this for a year. The plans are February 28th, 2020. It's time to get it out to bid, see what it will actually cost, and hopefully proceed this winter. I'd be glad to answer any questions.
Any questions?
No, but I tend to agree that, you know, if we're going to do this project, which we should do this project, because I do think that if we want to recruit large tournaments to come here, we have to have adequate facilities for them. But doing it over the winter, when people are not outside playing tennis, is probably the wisest use of time. So I would support this. I don't know if we're ready to make a motion yet or not, but
I'll second.
That was your motion, okay.
yeah, we'll call that a motion.
Motion made by Commissioner Mays, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Bob. Thank you, Joan. Next item.
Item E2, consider approval of request to solicit bids for on-call architectural and engineering services to include planning, design, and construction of capital improvements and replacement projects with funding determined as each project is planned and implemented.
John Boyd, Parks and Recreation again. We are requesting permission to go out for the on-call services for engineering and architect services. We last bid this out in 2017, and so we would like to go out and get some new bids. Any questions?
Any questions?
I'll move for approval.
I'll second. Motion made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, John. I think this is good to have these guys on, have these contracts. It helps speed up the work. Next item.
Item F, Administrative Services. Number 1, update on revenues and expenditures as of September 30, 2020.
Good morning, Betty Griner. Sorry, I did it again. I got my mask stuck on my earring. Okay. I'm here for the financial overview as of September 30th, 2020. We'll start with the year-to-date revenue. As you can see here by the chart, through September 30, we received revenue of $100,346,577. You can see from the chart here, but it's also, that is $3,973,511 under budget for the year, so just right at $4 million under what we had estimated for this year. This chart shows the different categories, and I'll go through each category individually, but this kind of shows the total amount. If you look at, I mentioned the $4 million, that is about 3.5% of our total estimated revenue. Okay, the first section we'll look at is property tax revenue, and we have received $81,162,230. That is $1,258,000 under budget, which is about 1.5%. And that has not changed significantly since our second half payment. We received a little bit of a distribution this month, and that was within $10,000 of what we had expected. Next category is other taxes. We have received $13,171,770. This is $242,000 under what was budgeted, which again is a 1.5%. But I had talked to you before about that I thought this section or this category would probably catch up because it is motor vehicle taxes, and those people have been coming in and getting those things done. In fact, the month of September, we were $213,000 over our September budget for just that month. So I think by the end of the year, this category could very easily get back up to budget. Next is charges for services. We received $3,356,821. That is $1,455,000 under budget, which is 25% for that category, it is 25% under budget. And that comes in from several sources. The largest source is Parks and Rec, which is $1,171,000 under budget. The detention facility, or the jail, is $519,000 under budget. And the sheriff is $91,000 under budget. But the Register of Deeds office is actually $442,000 over budget. As you all know, houses have been selling like crazy lately, so that has offset some of the losses. And as I said before, this we are showing a 25% decrease under what we expected. And then our last category for revenues is other revenue. We received $2,655,755. That is $1,016,000 under what was budgeted, and that is almost all in investment income. As you, as commissioners, know, we are very limited in what we can invest our money in, and we can only invest it in, say, CDs or money markets, those types of investments, some treasuries. But all of those, you know, we have seen the interest rates are just very, very low. And we are not allowed by statute to invest in stocks and that types of things that are getting the higher returns. Okay, so this is the pie chart that shows 81% of our revenue is from property taxes, 13% from other taxes, 3% for charges for services, and 3% from other revenue. Going on to the expenditure side, through September 30, we had either paid or encumbered $81,209,647. That is $4,818,000 under what we had budgeted. And this chart shows all the different categories that I will go into individually. So if we start with the first category of law enforcement, we had spent $36,129,872. That is $3,026,000 under budget, and that is primarily between the Department of Corrections, which is $1,622,000 under budget, and the Sheriff's Department, which is $1,058,000 under budget. That means that the DOC is 6.4% under budget for the year, or through September, and also the sheriff is 5.5% under budget for the year. Next category is recreation. We spent $11,279,536. That is $1,441,000 under budget, which is about 9%. Public Works, we've spent $6,937,161. That is right on budget. And this is only the public works that has been spent from the general fund. Now later on, I will show you all the different public works expenditures and a total of those. The next is public health. We've spent $7,130,260. That is also right on budget. And there again, this is just what is spent from the general fund. Administrative services, we've spent $10,382,204. That is right on budget also. And let's see. Okay, yeah, that's about all for that, but it's right on budget for the year. Last category is debt service. We've spent $9,350,612. That will be all of our debt service for the year because we pay interest in March 1 and we pay interest in principal September 1. So this is the total for the year in that category. It is, as we talked about last month, it is $290,000 under budget. That is because of some debt we had talked about issuing for this year, and we had budgeted interest for that, and that debt has not been issued. So this is just the pie chart that shows the different categories and how each category shows the current, the budget, and the prior year. And this is the pie chart that shows for this year's year-to-date expenditures, the percentages. Law enforcement is 44% of our expenditures, recreation is 14%, public works 9%, public health 9%, administrative services 13%, and debt service is 11%. And as I said, the debt service, we have already paid that, so throughout the rest of the year, that percentage on debt service will go down as the other expenditures go up. Okay, do you have any questions on the general fund numbers that I went through?
None?
Real
Oh,
quick.
excuse me.
Betty, as we're kind of in the home stretch of this year, are there any large expenses that we need to be aware of that are coming up soon?
None that have not been already encumbered. You know, we have some things in contingency and also things like that, but they have already been encumbered that I don't imagine there's some large ones that, you know. Now, some departments do have more spending towards the end of the year, and that is all taken into consideration when we allocate out the budget. We do not allocate it out straight throughout the year. We look at what the department generally spends each month. So there are some that will spend more, especially law enforcement. Sometimes they spend more towards the end of the year, but not any projects.
So with the exception of the debt service that you mentioned, is this probably what you foresee as a pretty accurate depiction of what we're going to end up with at the end of the year?
Yes and no. Some, you know, departments kind of wait till towards the end of the year to see what their budget looks like and then do additional spending at the end of the year. There's nothing that I'm aware of that is committed to right now, but sometimes there are things that the department may look at and say, well, this is something we've been wanting to do and we do have money in our budget, and then they would come to you as a commission and ask permission to do that.
Thank you.
Okay, since we are through, this was through 3 months of the, or 3 quarters of the year, I thought I would also go through the total that's spent on public works through this time of the year. So you can see the general fund is just one piece of what we spend on public works. We have project funds, we have the debt service for the Willard Bridge, which is paid out of sales tax. We have the sewer districts and townships. Now that number is so high because of the project we're doing on the Sherwood District improvement project, and that's why that shows 13 million. We have the special equipment fund, and then we have the capital outlay fund for equipment. So our total that we've spent through September 30 for public works is $26,839,428. And this just kind of, this is a pie chart that shows you, and that as of this year, 51% of those expenditures are on the sewer districts and townships. And as I said, that is because of that big Sherwood project. But for this year alone, the general fund is only 19% of that, because we have money that comes from state programs and from federal programs, and then from the sales tax. Then to do the same thing with Parks and Recreation, because generally we're only looking at the general fund, and they have other sources also that they make expenditures from. The general fund is the $10.3 million, which is what we look at when we do our monthly report, but they also have the Parks and Rec revolving fund, which are the 2 golf courses, the campgrounds, some of the summer camps. Then we have the Parks and Rec building maintenance fund. Then we have the excess reserves that you had given them, and they have still had some expenditures from that. Capital outlay fund, and then the parkland acquisition funds, which is money that's collected from the city as there are renovations or land development. So the total that has been spent for Parks and Rec through September 30 is $14,180,6 $780. And here, this just kind of shows you that only 73% of that is from the general fund. I think we tend to look at what we've spent in the general fund as what we have spent on Parks and Rec, and that is only 73% of it. So do you have any questions on either of those?
No.
Okay. Any questions on anything?
Thank you very much, Betty.
Yep, thank you.
Thank you.
Next item.
Item G, Commission, number 1, discussion of COVID-19 health orders.
Okay. Dr. Pedzino, you want to, oh, we got to stand up. Dr. Pedzino, would you like to fill us in on where we're at with your latest scorecard?
Good morning, Gianfranco Pezzino, Shawnee County Health Officer. Commissioner, I don't have all the information from the scorecard because it's being released sometime today, so it was ready for public distribution. I do have a few charts if you are interested, and probably this is the one that's most telling. Last week we were in the 5th straight week of increase in the number of cases in Shawnee County, so clearly not something that we would like to see. The other disturbing number is the proportion of positive tests, which has been creeping up again for the last 4 weeks in a row. And you can see we were at a low point in September of 3.4%. What that means is that about 3.4% of all tests done on Shawnee County residents were positive. And last week we were past the 6% mark. Anything above 5% is considered as a sign of high community transmission.
What do you contribute the rise to in cases?
Probably multiple factors, but the most important one is that there is just much more transmission in the community, so there are just more cases, and so it's a higher proportion of people tested that will show the virus. The number of tests was about the same. We always go around 3,000 tests a week, give and take. So when this number, this proportion of positive tests goes up, it's a clear sign that there are more people out there who are carrying the virus than the week before. Nothing really new here. The proportion of the distribution of cases by race. But the concerning part is, for me, when we look at Hispanic, they account for about 27% of all cases in Shawnee County. That's a lot. That's more than 1 in 4. That's more than twice the share of Hispanic as a general population in the county. There are several reasons for that. One of them is that they are engaged in high-risk occupations. They have been since the beginning, and they still are. These are the people who are often in contact with the public. These are people who often work in nursing homes, who often work in multiple nursing homes. And for a multitude of reasons, they are suffering from the COVID pandemic more than other groups.
Mr. Mason?
Dr. Pacino, if you break that down into a month by month in terms of the demographics, have we seen any change, since maybe we started the drive-through testing lane and things like that in the demographics of who is contracting it?
Yeah. Our ability of breaking data down at the level is still a little limited, but I can tell you that before we started, or right at the time we started our drive-through lane, the race pie chart looked different, and there was a higher proportion of African Americans that were represented in that chart. That proportion now has gone down to a level essentially which is quite similar to the one of African Americans in the community. The chart for Hispanic has taken a different shape, though. The proportion of Hispanic people with Hispanic origin who are affected by the virus has gone up pretty consistently. This is a distribution of cases by age groups, from the beginning in March to the middle of October. So this is comprehensive of all the cases that we have had. You can see it's almost a bell-shaped curve, where the people in the middle are more represented, and then the people at the two extreme were less represented. But if you move to the past 2 weeks, the distribution changes. So I'm going to go back to show you visually the difference. So this is all cases since the beginning, and this is just the last 2 weeks. You can see that there is proportionally a higher number of individuals in the kind of adult, not middle-aged adult groups, and definitely more individuals in the older ages until you reach the age of 74, after which the number goes down considerably. Hospitalization by age groups, you can see that out of 220, we had 220 cases that were hospitalized. That represents about 6.8 of all cases diagnosed in Kansas. And the yellow bands are the proportion within each group of people diagnosed who ended up in a hospital. And not surprisingly, you can see that that proportion increases considerably when you go to older ages. Now, there is a little drop of people 85 and plus. I think it's because we have very few people in that age group anyway. This is another way to look at hospitalizations, is the proportion of hospitalized patients within each group. So that are within each of those age groups. And you can see that in this case, about almost 22% of people who ended up in the hospital were between the ages 75 and 84. Deaths by age, again, not surprisingly, we had, as of yesterday, 77 deaths. We had a sharp increase in the number of deaths. I talked here a couple of weeks about the sort of artificial increase that was generated by the fact that we were reviewing records and adding old records to the count. The increase that we have experienced in the last 2 weeks, though, that's real. That's current. That's in real time. And just this week, we have suffered 6 deaths already, 6 deaths, and I believe all of them were from nursing home patients. So we are clearly very concerned about that. The number of deaths is going up, and the case fatality rate, which is the proportion of people with a diagnosis who dies, is about 2.4%.
Doctor, do we know, like this last group of people that died, how many of them had comorbidity and what those comorbidities were?
We do not have that information. There is some of that information is available in the surveillance system. It's not very complete, but we just didn't have a way to look at that. But we know from other studies that people with pre-existing conditions definitely have a higher risk of deaths. What the COVID virus does is accelerates the process, and so deprives people with underlying conditions of potential years of life that they could have lived. This is just a pure count of deaths by week, and again, you can see that there has been an increase in the last couple of weeks. That's the information I have.
Okay. You know, I was just going to give out some statistics that I know. I know that the recovery rate hovers around above 99%. Can we not put that on our scorecard? Wouldn't that be a good statistic to have?
Commissioner, I don't think that the statistics belongs in the scorecard, but it's something that's available. It's available in our dashboard. It's available in other statistics that are on our website. So it's not something we're hiding. It just doesn't belong in the scorecard. The scorecard is just an idea, is to give an idea of the trends of how the infection is spreading in the community.
So it's all about transmission, not anything else?
Commissioner Rippon, I mean, are you asking for it to be put on the dashboard, or are you asking for it to be put into the scorecard?
Maybe the dashboard's better.
It is already available in the dashboard.
It is?
Yeah, it's,
Okay.
all the numbers are there. In some cases, one has to do a subtraction of, total minus something else, but all the information is on the dashboard.
What about hospitalization rates? Do we post those?
Yeah, it's.
But is it,
This same presentation that's in front of you is posted on our website. Let's see, where was the hospitalization?
and we do it by age group, yeah?
Yeah.
Okay, good.
This page, yeah, this is hospitalizations.
Okay. I think this is good information to have out there, especially with parents that have kids going to school. I think this should calm them a little bit, seeing that in fact, almost every age group of kids and parents, it's pretty low hospitalizations. It's very survivable. In fact, I was reading about from the CDC and JAMA both said that children in the range of 5 to 17 have a much greater chance of being hospitalized by the flu that's coming up than by COVID. I think that's probably good information as well.
It's also a good call for people to get the flu shot right now, so they can
Probably
bring
not a bad
down even
idea.
that number.
Probably not a bad idea. I noticed, though, in your scorecard, you put a lot of weight on transmission and hardly anything on death rates. It's almost all on transmission. I was wondering why death rates aren't included in that.
Again, the scorecard is meant to be, in a way, exactly what you said. It's a way to monitor how much virus is circulating in the community. And we know that the more virus there is, the more difficult it is to protect people who have high-risk conditions. So that's really the goal of the scorecard. It's just to monitor the transmission and see at what level, as a community, we are in terms of COVID-19 transmission. It is not a comprehensive picture of all the statistics around COVID in Shawnee County. Scorecard should be complemented with the dashboard and with presentations like this that are on our website. As a matter of fact, this week we added the direct link, we added to the scorecard, the direct link to the dashboard. So people who want more information, they can go there directly from the scorecard.
All right. Last thing I wanted to talk about was our testing system. All of our tests, I understand, go to KDHE, is that correct?
No, it's a minority, actually. It's almost 90% of our tests are done outside of the KDHE lab. When I say our, I mean for Shawnee County residents, not ours, the health department.
Oh, really?
The tests that are collected by the health department, they all go to KDHE.
All the ones from the health department?
The health department, yes.
And I was reading about this, the way they set the threshold for when they amplify the looking for the DNA. And I was reading an article where they said that anything over a setting of 34, generally all you're finding is a dead virus. You're not finding anything that's transmittable. And I noticed that our state lab has a setting threshold of 42. There's a possibility then we could be getting a lot of false positives in from that, if that's true, if that's where their setting is. And I know they did a study in New York, Massachusetts, and Nevada, where they checked these thresholds, and they found that almost 90% of the positive tests were positive negatives because of the threshold they were using. And I was just wondering, in Kansas, do we have that same issue? You could imagine if 90% of our positive tests are false positives, that would make a tremendous difference in our ability to contact trace. It would change a lot of things. But I just wonder if anybody's looking into that to see why they are so high.
Commissioner, I guess, and again, making sure that I understand the question you're asking. The question you're asking, Dr. Bozzino, is do we have a high rate of false positives in Shawnee County when looking at our current rate of infection? Is that the question you're asking?
Well, yes. I mean, are all these positive? We have a big spike. Well, it may have been happening for months. I don't know. But if we're testing these people at, what did I say, the rate was 42, one at KDHE lab, state lab, maybe the majority of those are false positives.
So I guess then that would be the question for Dr. Bozzino is, do we have concern of false positive results in Shawnee County when looking at our curve, which was the first slide that you showed?
A couple of things. My question is going to be pretty quick. Those thresholds are not set by us, of course. They are usually set by the manufacturers of the test kits. And then the labs also have some ways to maybe some ranges that they can use. I have absolutely no control, nor do I have any knowledge about how the KDHE lab conducts their test. But once again, almost 90% of the tests done on Shawnee County residents are done outside of the KDHE lab. They're done through a variety of reference labs throughout the country. If we had a large number of false positives, you call them, that wouldn't explain the increasing number of deaths, for example. And also that number would have been constant, more or less, throughout the entire pandemic. And so it also wouldn't explain why we see curves like this, where you have for 5 weeks in a row an increase in the number of cases, even assuming that some of those cases are false positive, which again, I have no evidence that that's the case. Remember that most of the people, almost invariably, who are tested in Shawnee County still are people with symptoms. We do relatively very little testing in people without symptoms. So I'm confident that, this thing is real. I mean, this epic curve would not look like that if this data were not reflecting what's actually happening in the community.
Mr. Chairman, I think that's maybe, if I could ask, Dr. Bozzino, I want to make sure that I understood. Still in Shawnee County, you have to present at least 2 symptoms to get tested by the Shawnee County Health Department in the drive-through. If I wanted to go, or if Commissioner Rippon wanted to go just for our own edification of knowing whether or not we are positive and we have no symptoms, we would be turned away by the drive-through clinic, correct?
So things, yes, what you're saying is correct, with some caveats. That is true for the tests that are done through KDHE. So if you go through the drive-through line that the health department conducts, yes, that is true. Also, that changes as we speak. As a matter of fact, I believe this week, KDHE moved from at least 2 symptoms to at least 1 symptom. Third, as I said, the vast majority of cases are not done through KDHE, and then at that point, it's up to the testing site to decide their policies. To my knowledge, nobody allows people without symptoms to just walk in and say, hey, I want a test. But people can go with a note from their doctor requesting a test, and in many cases, they can't get the test done whether they have symptoms or not. But they still need a note from the doctor, and so usually their doctor will not give a note unless there is a reason for that to happen. So things are a little bit more complicated just because we have so many testing sites throughout the county. But in general, there is very little, if any, testing done on people who are totally without symptoms and they say, hey, I feel like going and get tested, and then they end up being positive.
Doctor, do you know what percentage of people that we test are test positive?
Yes, that was the chart that I showed here.
6.1.
6.1 last week.
So last week it was 6.1.
6.1. And yet our recovery rate is still well above 99.9 for all age groups.
I don't have the number with me. It is what's on our dashboard, yeah.
Okay. You're familiar with the Great Barrington Declaration. I see it's picking up a lot of steam now. It now has 34,000 medical professionals and scientists have signed off on it. Do you have any feelings about it one way or the other?
Commissioner, I already explained those feelings that I have multiple times here. Let me make a more general statement, if I may. The job you hire me to do is to prevent disease and deaths in Shawnee County, and that's exactly what I'm trying to do. To be totally frank, sometimes I feel like you are not helping me doing this job. You are questioning continuously what the health department strategies are, results in undermining our message. And there is a big concern in my mind that when the message is undermined like that, people get confused, people lose trust in what we are doing, and I think that's certainly one of the factors why we see this kind of epidemiologic curves that go in that direction. So I'm not sure I can tell you anything more than what I told you 2 weeks ago about what my feelings are. I'll be happy to answer any real questions that you may have when you want to get new information from me, but I would urge you really, we need a Board of Health that shows unity and a unified message for our citizens. Anything else is going to be so confusing that these are the results. And if you want a health officer and the chief of the health department that establish different strategies of what we are doing, you have control over that as a Board of Health. You can hire a different health officer, but as long as you keep these people in place, please do not undermine our message. Our job is already hard enough the way it is.
I'm just pointing out there's other schools of thought, and these are professionals. These are people who teach epidemiologists, the people that put this together, and you know, we're learning a lot about this virus as we go through the year. We know a lot more about how to treat it. We're doing different things, and I think there's always a chance to learn and say maybe we're not doing things the way we should. I don't think that's bad. I don't think it's bad to question it. You know.
Again, I have answered all those questions 2 weeks ago, Commissioner. I have nothing more to say.
All right, but two, you know, I have to look. The commissioners here, we were brought into this disaster, and because it's beyond a virus. We have to look at the economics of things, and we have to look at, you know, we have to look at people's businesses. We have to look at people who want to gather to worship. We have to see if we're effectively educating our kids, and these are other items. So this Barrington Declaration does open things up a lot more, and there's a lot of professionals who think that's the way to go. And I just wondered if you were studying it, staying on top of it.
Oh, absolutely. I can also guarantee you that there are many more professionals that vehemently disagree with that declaration, and that information is also public. And I encourage you to read those statements as well, and when you report on the Barrington Declaration, to also quote those statements.
All right. Any other comments?
Just, Dr. Pizzino, has anything changed as far as the recommendations of washing your hands, maintaining a social distance or physical distance, wearing a mask, and you know, maintaining a risk assessment when entering if the place is crowded? Has anything changed with those recommendations?
And avoiding large crowds and gathering. You got it, Commissioner, you got it. Okay. Those 4 things, if we could all practice those 4 things, we would go back to having, you know, 30, 35, 40 cases a week, things that we can manage. Then we can contain those cases from spreading. Then we can protect our population at high risk. Avoid large gatherings, mask, hand hygiene, and social distancing. It's not that hard. but it would be easier if we could convey the message as a unified front, as a Board of Health and health officer and the health department. And that's not what's happening in Shawnee County, unfortunately.
And then when we're looking at the transmission rates and the survivability rates and the death rates, I think that we should also keep in mind that we don't live in an isolated bubble, that we are interacting with other age groups. Even within this own commission, we have individuals in different age groups. And so if I may be not as affected, but I come into contact with someone who is possibly more likely to be hospitalized, we should keep those things into consideration still, correct?
That's correct. It is estimated that about 30% of the general population has at least one risk factor for severe disease. And a very small number of that 30%, by the way, is institutionalized in nursing homes. So I fail to understand how we are going to insulate and protect that 30%, potentially for many months or years until the herd immunity, so-called herd immunity, is developed, how we're going to protect them from any kind of exposure to the virus.
And then the U.S. reported the third case this week of reinfection. Doesn't that cause some concern about whether herd immunity is viable or not, or whether or not this is a limited immunity as opposed to a herd immunity?
Again, we are still learning a lot about how long the immunity lasts, but at the beginning, we believe that people were really immune, and now, as you said, there is at least 3 cases that have been well documented with viral studies and everything else, where people who had already been infected the first time got reinfected a second time. Right now, we take 3 months as a safe window of period within which people can consider to be immune. But if we have people with symptoms now, past 3 months from the first time that they tested positive, we test them again, just because of the studies that you mentioned.
If people can get the virus a second time, would a vaccine work? But it's going to be like the common cold.
That's a great question. Depends on the vaccine, and maybe that it's a vaccine that needs to be repeated multiple times, just like we do with influenza vaccine. I don't know. People are still studying this issue.
Dr. Pizzino, is there any way that we can measure the amount of virus in a person when we do the PCR test? I mean, or do we just get positive or negative, or do we get back and say, like, this person is really, really infected, or this person has just a trace?
Right. That goes back to Commissioner Ripon's question about the lab techniques. Please understand I'm not a lab specialist, so I will give you my best informed answer. The way that the PCR test works, so the typical gold standard test works, it amplifies for a certain number of times whatever genetic material is in the specimen that comes from the virus. And as Commissioner Ripon was mentioning, the number of amplifications that is done varies from lab test to lab test and from laboratory to laboratory. It's typically around 35 to 40. I think 38 is one of the most common thresholds. The moment that the lab finds sufficient genetic material amplifier, they stop. So they don't always do 38 amplification cycles. If they find enough material at cycle number 5, they stop at cycle number 5. If they go to 15, they stop at 15. So some people are advocating, and I think there is some merit there, why not reporting in the lab test results also the number of amplification cycles that was necessary to detect the virus in sufficient numbers. And again, I'm not a lab specialist. I think that would make sense. I don't know what it is done. I cannot answer the question. The challenge would be, though, that would be only helpful if we can identify the pretty safe threshold above which anything we detect is just non-viable material, and maybe from an older infection or cross-contamination, whatever. I haven't seen that yet. I haven't seen anything that says, past 20 cycles, you can discard that result because it's not infectious. But I think this is a promising line of work, and we would love to have that information, because right now the test is only yes or no. It doesn't give you any other indication.
Okay, and that was, I think, what I was trying to figure out is if it is a yes or no type of thing, or if they report that, or even record it at all, how far into the test they get before they call it a positive. So,
Yeah.
I think it would be good if they could give us amplification numbers and see how high, how close they had to look at this, at their samples. I think it's very telling. You know, if they have to ramp up to 40-some amplifications, then they're probably looking at dead strands of virus.
Yeah, I don't disagree with you, again, with the caveat that they also need to give us a way to interpret those results. Somebody needs to do enough study, enough research to be fairly confident that anything above X, whatever the X number is, should not be considered as a positive, because you can imagine the risk if we start calling people non-infectious, and in fact they're still infections because they had 22 or 23 amplification cycles, then they go around and spread the disease to other people. But yeah, I would love to be in that situation. I think most public health people would.
Well, the CDC was the one that came out with the setting of 34 is kind of the standard. If it goes over that, then you're probably not looking at anything that's transmittable. But we don't know what our tests are looking like. But when they did do when they looked at other states, they found that they had a lot of what they call positive negatives. They found something, but it may not be transmittable or alive.
Yeah, that's true. But again, I want to be very clear with our message. This conversation should not be interpreted as meaning that what we are seeing in Shawnee County maybe is a bunch of false positive results. It's not. People are dying, and people wouldn't die if this was just a false positive result.
How low do you think things would have to get? What kind of transmission rate would we have to be at where we would just do away with our
goal
orders?
is to have 2 consecutive weeks on the scorecard in the yellow zone, and then we can start examining some measures that could be possibly relaxed a little bit at a time, not all together. And that accounts, I think that's an average untitled scorecard in front of me, but between 75 and 100 cases a week, if I'm not mistaken. But remember, the scorecard includes more things than just the number of cases. But I remember when we were hovering around 70 to 80 cases a week, we were doing okay in terms of being able to control those cases. Now we are over 200.
Our recent deaths, were they in nursing homes or?
Yeah, I believe all of them were from nursing home patients.
Okay.
So would that not be an indication that we are not protecting our vulnerable population?
Well, they're not vulnerable, they're high rate, or high risk. I was told
That's an
we're all
indication that, here is what that is an indication for me. That's an indication that no matter how hard we try, and believe me, they are trying so hard. Our staff in our nursing homes are working their tails off, and there are tears every time they lose a resident. So this is not taken lightly. No matter how hard we try, when you have over 200 cases a week in the community, there's no way to protect any group at high risk, including those in nursing homes, let alone those who live outside of nursing homes.
And I guess that was more my point, is that the virus is still very much within our community, and no matter what protections we try to put in place, we have a very high rate of infection, which is contributing to the results we're seeing in nursing homes.
I agree, and people are in a nursing home because, well, they need nursing care, right? And who provides their nursing care? Nurses, CNAs, staff, people who have lives. Then when they're done, they go home, they go in the community, and invariably, an outbreak in a nursing home, I was going to say invariably, but the vast majority of times, happens when a staff brings the virus into a nursing home. Inadvertently, of course, nobody would do that on purpose. Once it's there, it's very hard to control, just because if you think about the typical engineering in a nursing home, no matter how hard they try, they still have residents who are in very close contact with each other all day long, day and night.
Dr. Pizzino, since we're on the topic of nursing homes, obviously we saw the case in I think it was Norton, where 100% of the residents in a nursing home.
Northrop County, yes.
And
Norton.
And 10 of them died this week, and you know, that's scary to see that. Have we had anything even remotely close to that in terms of a percentage of a resident population here in Shawnee County? And I don't want you to name specifics, obviously, but you know, what's the most severe cluster that we've seen to date?
Commissioner, I don't have the numbers with me, so I'm hesitating a little bit to give a specific answer. I'd be glad to provide those numbers to you with more preciseness after the meeting. I know we have not had any situation even remotely close to having 100% of people affected. Now, that was also a relatively small nursing home.
Yeah.
So, you know, 100% of 70 patients is different from 100% of 700 patients, of course. But we have had nursing homes with a double-digit attack rate and a double-digit number of deaths. And so obviously, you know, by my standard, those are high numbers. But I can be more precise later after the meeting.
Also, still on the nursing homes, and maybe this is a better question for someone else, but do we keep track of the PPE that they have at the nursing homes? I mean, are we confident that they have enough PPE to protect their residents as people come and go throughout the day? And
yes, my understanding is that there is enough PPE. If anybody on the staff, if I'm misspeaking, you can tell me. So the availability of PPE doesn't seem to be a problem.
Good morning. The level of PPE is balanced, or I shouldn't say balanced out, but it's monitored by emergency management, and those relationships and methods, processes were established in April, I mean, way back when. So, and they monitor the level. If they needed PPE, they get a hold of emergency management and they work those things out if they can't obtain it themselves. So yes, as far as we know, those levels are pretty solid. If they're not, we hear about it pretty quick.
Dusty, while you're up there, for that PPE, I know we approved the purchase of a couple of fit testing machines recently. Mm-hmm. Are those out and in the community?
Yes.
So that those folks in the nursing homes we're making sure that they have not only enough PPE, but they're using it properly?
Yes. Those machines are specifically, they're fit test porta-counts is what they're called, to fit test the N95s in different styles of masks to make sure they're properly fitted. So people don't get sick, and we don't see these incidents that attributing to these incidents of cases as well. Was in a training last Friday. We had hospital personnel over there with us going through that training, and that was a trainer learning how to use that porta count. And then we also have those machines available now to assist locally if we need to fit a bunch of people in their home because of a high turnover rate or something else. So yes. The short answer is yes, sir.
Okay, appreciate it. Thank you.
Are the nursing homes using that equipment, or are they?
I'm sorry?
Are they using that equipment to fit masks?
The people who are trained to use that equipment go on site, train, and fit the people who need those masks. That is correct.
Okay. What else can we do to help protect the high-risk people in nursing homes? Is there something that we can do? Or what else are we doing, I guess, other than helping fit masks?
My answer again is very simple. We need to control community transmission. That's the best thing we can do. Other than that, I think they're doing everything. It's within their means and everything we know. And if anybody has different ideas, they're more than welcome. We will take them into account.
Do we do more testing there of staff and
Yes, we're doing a lot of testing, and that's actually now mandated by CMS, or the federal government. And each nursing home, my understanding is that they have a testing machine on site. And depending on the level of community transmission, they have to test a different frequency. So right now, since we are going to be above 5%, they're going to be forced to test every week, all their residents, all their staff, and that's a lot of testing. I'm certainly not against testing. I've been a big advocate of testing. I want to be sure that people don't over-rely on testing alone is not going to get us rid of the virus. As long as we have these kind of scorecards, we will test and we will find more people positive, and testing takes a lot of time. You can imagine, especially in a nursing home, when you have residents that are not, often they're not cooperative, especially if you have, dementia units and things of that nature. it can be very traumatic. Some residents need to be sedated so that the test can be done. So it's not a good situation. So testing is being done, but that alone is not going to solve the problem.
And I imagine a lot of them don't wear a mask, too.
Absolutely.
Yeah.
A lot of people, do you say wear a mask?
Now, I imagine a lot of the people in the nursing home do not wear a mask.
Oh.
The patients,
The staff are expected to wear a mask at all times, and residents will wear a mask when they
Right.
have an interaction with the staff, yeah.
But the patients that live there.
Patient to patient, especially again, when patients are incapacitated already, it's very difficult to enforce.
Just to clarify something that you said, and I think I understood it properly, but is it that CMS makes the rules for the nursing homes and not necessarily Shawnee County?
Yeah. Well, certainly Shawnee County Health Department does not regulate nursing homes. The county as a whole has very little role, if any, in regulating nursing homes.
Okay.
Most regulations come down from CMS and then through the Kansas Department of Aging and Disabilities. They are the ones who regulate nursing home for the state, but usually all the regulation is based on federal guidance.
Okay, good. I think that's just an important clarification to make.
Yeah.
Thank you.
Now, having said that, Commissioner, if I may, we are working very hard with our nursing homes, so we don't regulate them, but that doesn't mean that we don't help them.
Right, I understand that.
Derek can tell you how many hours during the day and night he spends working with nursing homes.
Thank you.
Do they allow visitors at the nursing homes here? I mean, can family?
If they have had cases in the last 14 days, they do not allow visitors, which is another big deal because it's so hard on the residents. It is so hard. I mean, it's totally necessary. I'm the one who asked nursing homes to stop all visitors when we went into the red zone of the scorecard about 2 months ago. But there are nursing home residents that will tell you, if I can't live like this for many more months. I'd rather shorten my life and be able to see my loved ones. It's incredibly hard on them.
It is. Do they quarantine people before they bring in new patients?
Yes.
Or they do?
Yes.
Okay. All right. All right. Any other questions? All right. Well, thank you, Dr. Pezzino. I know this is not an easy thing we're going through, but it's hard to set up here each week and just smile and nod too and think, is there anything we can do? Is there more we can do? And I read up on this a lot in the evenings, and there are other schools of thought. They're out there. Maybe they're right, maybe they're wrong. I don't know. They'll write books about 2020 years from now, and it'll be 2020 hindsight. So, what's next?
Item 5, Administrative Communications.
This time, anyone from the public can speak or from any department?
Good morning, Commissioners. Dusty Nichols, Incident Commander for COVID Response, but I'm going to speak on behalf of Emergency Management, who wants me to remind you that this is probably going to be the last nice temperature day of the year, and it's going to drop pretty quick. So if you haven't made those last arrangements to weatherproof your house or RVs or pools or whatever else, you might get on it today. Thanks.
Good morning, Commissioners. Linda Oaks from the Health Department. A couple of announcements. It's interesting that you brought up the testing site because indeed the guidelines have changed. And so now KDHE has announced that anyone who has one symptom of COVID-19 can be tested. Anyone who's traveled to any of the regulated quarantine areas, and those are all on the website, or had close contact with a lab-confirmed COVID-19 case can now be tested. So if that's totally confusing and you think you should be tested, you can call our number, 251-4949. We can walk you through that. We are changing the times of the testing because the weather is getting colder. It will be Tuesdays and Thursdays from 11 a.m. to 2 p.m., still at New Mount Zion Baptist Church, was at 2801 Southeast Indiana Avenue. So again, if you want to be tested, you have questions, 251-4949. We're also going to be offering a couple more flu vaccine opportunities next week, and we'll announce these again next week. But Tuesday, we will be offering a vaccine clinic for Vaccine for Children, VFC, eligible children. And so that is children who have Medicaid, who are in the Children's Health Insurance Program, uninsured, American Indian, or Alaska Native. Those children can get a flu vaccine. That clinic will be held from 4 to 6:30 p.m. at the J.P. Lewis Building, which is at 2600 Southwest East Circle Drive. You need to bring your card if you do have any of these insurances, and anyone over 2 needs to wear a mask. And then next Thursday, we'll have another opportunity for uninsured adults, and we'll put those details out again next week. And so we'll be continuing to offer these flu vaccine opportunities. Thank you.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. I just wanted to kind of give everybody an update on the 3 major projects we have going on with the Department of Corrections. We've been working very closely with Betty Greiner, Bill Kroll, and Jim Crowell regarding just the continued progress on the 3 projects that were all COVID-related that are being funded through the COVID CARES Act money. One of them being the multi-purpose room, which was the old kitchen area. We're converting it into a virtual conference area that will have multiple areas for to increase and improve visitation, Zoom, and virtual contact with attorneys, probation officers, and things like that. That project is still, and it is scheduled, as Betty has mentioned, that has to be up and running by the end of the year. They have shifts of teams coming through there. I go through these areas more than once a week. It is quite the art of how well these guys are doing the job they're doing. The walls are up in these areas, and they're moving along, and we hope, and my understanding is they'll probably be done well before the beginning of the or the end of the year. The modules, we are also including in the, not only are we going to have the virtual conference room that we can take inmates to, but also when staffing gets bad where we don't have a lot of ability to transport inmates to the conference room, we are also making virtual conference rooms or areas in the modules themselves, which will improve confidentiality with their attorneys. Again, probation officers. We are also working with Lee Welch and the courts on including the Kansas Department of Corrections, involving this to be able to have virtual court appearances at the State Department of Corrections and stuff to reduce transportation. I wanted to throw that out because that's going to be huge also when we get that. But that one there, I want to say it will get done before the end of the year, but will have the biggest impact on the modules themselves, because we do have to shut down those visitation areas for up to 2 weeks, maybe a little longer than 2 weeks, because they're actually tearing out walls that are in the modules. So during those times, and we will make sure that we put public notices in the lobbies on our website, that during those times inmate visitations for families for the will be down at that time. And we will make sure that inmates, that they're not charged for anything, that they won't be able to sign up or anything like that. The inmates that do have tablets, they can still use the phones, they can use the tablets for phone calls. And again, there's also our desire that, in our hope, and we are on track for this, that every inmate will have a tablet by the first of the year, and that we can include visitation on those as well. So that will have the biggest impact of as far as inmate visitation. The last is the HVAC area in our medical area. This will convert every room to a negative airflow room, which I think will be probably the first of its kind, maybe, I don't know, in the nation. I would say in the state or maybe the Midwest, that the entire medical area is zero negative airflow room, that will allow us to serve our community, to help other facilities, which we have, where we have non-compliance people with tuberculosis or whatever. We will have sufficient rooms to be able to do that. They will close down 3 rooms at a time to do that. They're going through that now. We should be done with that fairly soon, and then we're waiting for the big HVAC equipment to be delivered to put on top of the facility. But I think it's important that the community and everybody and the commissioners understand we're doing our due diligence, financially being responsible, also working with the health department and doing everything we can to mitigate the spread inside the jail. I think it's very important that the jail was listed as a cluster about a month ago, where most jails were ranging very high percentages of 30, 40, and some even 70. We had an infectious rate of 7%, which is very high. And I give that kudos to the staff, Corizon, and the health department that prepared us and emergency management prepared us and how to set up our process. It has been tough. It has been a challenge. We have lost staff during this time because of the COVID. So like this, but we're doing everything we can to make things safe for the staff, and this is I just wanted to make sure everybody understood that we're moving along, we're staying within the guidelines of COVID cares. Betty's keeping a watchful eye on that, so we're educating, and we're doing the best we can. And I'll stand for any questions you may have during this.
Any questions?
Thank you all very much.
No, thanks, Brian.
We have no need for executive session, so we're adjourned.
Did anybody else have any?
What's this?
Did the commissioners have
Oh, do you have anything
comments?
to add?
Just, I want to thank our staff for pointing out just a couple of examples. I mean, the health department has been working exceptionally hard in difficult times. The emergency management, the Department of Corrections, all the departments have been working really at top notch during the pandemic, and just want to recognize that in the elections office, in all that they've been doing, and just the staff and the professionalism across the board. But especially today with the health department and what they're doing and how they're doing their job. And sometimes it just doesn't get said thank you enough from the commission, so thank you.
Yeah, I would agree with that. I think, what Commissioner Rippon said, the books will be written about 2020. I think everybody in this room could probably write their own. The amount of new job responsibilities that our staff has had to take on this year with what's looking to be a record-setting turnout for an election, when staffing levels are down, when, audit finance gets a whole new budget to work with the same staff that they normally do. And emergency management we had flooding, a 100-year flood earlier this year that they've dealt with in addition to COVID, and the health department and everything they're doing, trying to maintain their regular jobs as well as deal with COVID. And the list goes on. I think we could go through every department, and the job has changed. And we appreciate everything that you guys are doing. Thanks.
It has been an unusual year, and we do have excellent staff, and I appreciate all that you do. So, thank you. We're adjourned.